Welcome back. Today we are looking at the body in motion, more specifically the muscular system. There are more than 600 muscles in the body and they are all attached to bones. The role of the muscles is to contract. When they contract, we move. Muscles are unable to push the enable movement. Instead, they shorten, causing joint movement, then relax as opposing muscles pull the joint back into position. To locate muscles, it is important to establish the origin and insertion of the muscle. The origin is where the muscle attaches to the most stationary bone involved in the movement. The insertion point is the attachment at the movable end of the joint. The muscle action is what movement of the joint is made when the muscle contracts, for example, flexion or extension. We'll start by having a look at the muscles in the upper limb. The deltoid is located in the shoulder. Its origin is the scapula and the clavicle, and its insertion point is at the humerus. The deltoid assists with the abduction of the upper arm. The biceps brachii is located in the upper arm. Its origin is the humerus and the scapula, and it inserts at the radius. The biceps brachii assists with flexion of the arm and forearm and supination of the forearm. The triceps muscle is located in the upper arm. Its origin is the scapula and humerus, and it inserts at the proximal end of the ulna. It assists with the action of extension of the arm and forearm. We will now explore the muscles of the trunk region. The latissimus dorsi is found in the middle of the back region. Its origin is in the spine from the T6 to the L5 vertebrae and the iliac crest. Its insertion is at the proximal end of the humerus. The latissimus dorsi assists with the action of adduction and extension and rotation of the arm. The trapezius muscle extends from the top of the neck down the back. Its origin is at the base of the skull, the C7 to T5 vertebrae. It inserts at the scapula and the clavicle, and it assists with the joint action of the adduction of the scapula and the elevation of the shoulders. The pectoral muscles are located in the chest region. Their origin is at the sternum and the clavicle, and they insert at the head of the humerus bone. They assist in the action of flexion and adduction of the arm. The erector spinae muscle goes from the neck all the way down to the lower back. Its origin is at the base of the skull, and it inserts at the sacrum at the bottom of the spine. Its action is the extension of the back or the trunk region. The gluteus maximus is located in the buttocks. Its origin is the posterior surfaces of the pelvis and the sacrum, and it inserts at the femur. It assists with the action of extension and abduction of the thigh. The rectus abdominis is located in the stomach area. Its origin is at the crest of the pubis, and it inserts at the ribs 5, 6, and 7. It assists in the action of flexion of the trunk area. The external obliques are found in the side of the trunk area. Its origin is at the lower 8 ribs, and it inserts at the iliac crest. It assists in the action of flexion and rotation of the trunk area. We will now have a look at the muscles in the lower limbs. The hamstrings are found in the posterior side of the legs. Its origin is at the ischium and the femur, and it inserts at the tibia and the head of the fibula. The hamstrings assist in the action of extension of the thigh and flexion of the lower leg. The quadriceps muscles can be found in the anterior of the leg. Their origin are the iliac crest and the femur, and inserts at the tibia, at the proximal end, and at the patella. The quadriceps assist in the action of flexion of the hip and extension of the lower leg. The gastrocnemius is found in the posterior side of the lower leg, otherwise known as the calf region. Its origin is at the distal end of the femur and it inserts at the posterior side of the heel bone. The gastrocnemius assists in the action of knee flexion and plantar flexion of the foot. The soleus is located in the lower part of the leg, generally behind the gastrocnemius. Its origin point is at the tibia and the fibula, and it inserts on the posterior side of the heel bone. It assists in the action of plantar flexion of the foot. The tibialis anterior is located in the lower half of the leg on the anterior side. Its origin is the tibia, and it inserts at the ankle, the tarsal, and the metatarsals. The tibialis anterior assists in the action of dorsiflexion and inversion of the foot. We will now have a look at the muscle relationships and how muscles actually move. In producing a particular movement, a muscle performs one of three roles. It can act as an agonist, antagonist, or stabilizer. An agonist muscle is the prime mover. It causes the action to occur, and it contracts during the movement. For example, a bicep curl, the bicep brachii would be the agonist. The antagonist muscle relaxes and lengthens to allow the agonist to contract, and it controls the movement of the agonist. For example, in the bicep curl, the tricep brachii. A stabilizing muscle will allow correct form and it will stabilize the moving joint. So for example, in the bicep curl, the trapezius and the deltoid. In this video, you can see that the bicep muscle here is acting as the agonist, and the antagonist, you have the tricep acting at the back. The deltoid up here is acting as a stabilizer to stabilize the shoulder joint. When a muscle is stimulated, it contracts. There are three main ways that a muscle can contract: a concentric contraction, an eccentric contraction, and an isometric contraction. During a concentric reaction, the muscle shortens. So for in this case, the bicep has shortened to allow for the concentric contraction. Eccentric contraction occurs when the muscle lengthens. Example, in the extension of the bicep curl, the bicep has lengthened. Eccentric contractions often happen with the assistance of gravity. Isometric contractions occur when the muscle fibers are activated and developing force, but the muscle length does not actually change. So for example, pushing against a closed door, or in this case, holding the barbell at a fixed height. Remember to answer the theory questions for this video so that we can apply these in a practical session at a later date.